Thanks very much, Laura. It's an absolute pleasure to be here to welcome you all to our inaugural conference of the ESRC Centre for a Society of Mental Health. Absolutely delighted that you could join us, and it's wonderful to see so many of you here and joining us in the conversations that we hope to have over the next few days. My name is Craig Morgan. I'm Professor of Social Epidemiology at King's College London and co-director of the Centre for Society and Mental Health. And before introducing our opening plenary speaker, I wanted to spend a few minutes just to briefly introduce the work of the Centre and to set out the aims and structure for the conference to provide a kind of initial orientation to what you can expect over the next 3 days. So to start with the Centre. So we established the Centre in January 2020 with the aim to examine the impacts of recent rapid social change on mental health with the overall vision of delivering research to promote and sustain good mental health in communities. So why this focus? Well, in high-income countries, at least, there's been evidence that the prevalence of mental health problems has risen in recent decades, particularly among adolescents, marginalized groups and communities. And while these trends might be confounded by increased public awareness, the evidence for real increases in some groups is compelling. And these trends have occurred against a background of rapid, far-reaching and varied changes that have transformed many aspects of personal, social and economic life. The consequences of many of these changes have been rising inequality in many high-income countries. So this was our starting point to examine the impacts of rapid recent social changes on mental health. And as it turns out, and this could not have been a more timely focus, no one could have anticipated that within 3 months of starting the Centre, we'd be living through one of the most sudden, profound periods of social change in living memory as a consequence of the COVID-19 pandemic. Not surprisingly, there are widespread concerns about the impacts of the COVID-19 pandemic on mental health, both in the short, medium and long term. Verity, if you could change the slide, please, thank you. And much of the research and outputs during the first year of the Centre are very much focused on the impacts of COVID-19. But to put this more generally in context and to give an idea of the structure of the work in the Centre comprises or is focused around programs of research across 3 key areas where we think social, cultural, economic changes have produced substantial challenges no doubt amplified by COVID-19. And these are in relation to young people, in relation to marginalized communities, and in relation to work and welfare. And the first set of parallel sessions after Professor Galea's talk are centered on these areas. In addition, we work closely with users, communities, practitioners, policymakers, and our aim is for all the research in the Centre to be developed and co-produced with affected communities, mental health service users and other stakeholders. And we have a mandate to build social science mental health research capacity through education, training programs and opportunities and so on. So the Centre is interdisciplinary, and to realise our vision is necessarily collaborative across faculties at King's and with a wide range of academic and non-academic partners in the UK and internationally, and currently has around 30 staff, many of whom I hope there'll be an opportunity for you to meet over the next 3 days and are shown on this slide. So I hope that this gives you a bit of a feel for the Centre, for its overall aims and how it is structured. Part of the purpose of the Centre, part of its vision, is to influence debate in research, education, policy on mental health, making the case for the fundamental importance alongside other elements of society of how our social lives, of the importance of our social lives in shaping our emotional and mental worlds. That is to contribute, as Laura mentioned, to shifting the narrative to a more thorough consideration of the social context of emotional distress and suffering. That is, we want to involve or be involved in a conversation that will ask the question over the next 3 days: what should we talk about when we talk about mental health? So for the conference itself, we've got 3 primary objectives that we want you all to go away with at the end of the conference. We want to provide an initial introduction to the work of the Centre and to our approach. We want to have facilitated a series of what we hope will be stimulating, thought-provoking, and at times maybe challenging contributions. And we want to have connected with and engaged with you all, both during the conference in what we hope will be a series of fruitful discussions, but beyond as well. We want to connect as broadly as possible. And it's for this reason that we're delighted, especially delighted, that so many of you have registered. One of the positives, if that's the right way to think about it, of our moving online is that it's been possible for us to engage with and for more people to join from across the world than otherwise would have been possible. And we're thrilled to have participants from over 40 countries, close to 50 countries, from many organizations and backgrounds. So what should we talk about when we talk about mental health? Well, the conference is focused around a theme that provides an answer, a possible answer to each to this question. So day one is focused on, and we talk about inequality and power. Tomorrow we talk about communities, particularly marginalized communities. And finally, we talk about in day three about policy, about action and change, taking the next step. We move from what we should talk about to what we should do. In preparation, we asked you all to let us know what your answers were to the question of what we should talk about. And this word cloud summarizes some of your responses. Hannah Kienzler, our co-director, will consider this in more detail opening tomorrow's session. So it just remains for me to say thank you for joining, to welcome you all. And I'm very much looking forward to engaging with you all on this question over the coming days. And I now have the very great pleasure of introducing our opening talk by Professor Sandro Galea. Professor Galea's work on population health is an inspiration to many of us, and indeed the theme and central question for the conference is inspired by the premise of Professor Galea's recent book, Well, in which he asked the question, what should we talk about when we talk about health? And many of the answers that Professor Galea proposed in his book relate to the kinds of themes that I hope that we will be able to cover during the next 3 days: money, power, politics, fairness, justice, and the public good.